It's a really lonely disease, eh? It's really lonely. And it makes you feel like there's no one else in the world who's going through this.
Couldn't sleep, and you were tired all the time. And you'd figure if you're tired all the time, you can sleep, right? But there's no way you can sleep. Or if you do, it's for an hour at a time.
Inside, I was suffering a lot of turmoil because of the split between the way I saw reality, the way I saw things, and what actually things were.
I was smoking a lot of weed at that time, and I think then the symptoms started getting worse, right? I started thinking that I was going to save the world, and I started getting really... It's common with schizophrenia that you start getting high-minded religious thinking, and that started happening too. And 3 days later, I was standing nude on top of a building thinking I was being crucified for the sins of mankind, and that a spaceship was hovering above me, decoding my DNA.
My thoughts were like listening to 10 different radio stations all at once, but not quite on the channel. I was really anxious. My moods or my feelings would change just in an instant.
Like I'd go into a room, right, and there'd be TV on, and all the words coming out of the TV hit me like bullets, like they really hurt, and it was like shards of glass through me because they just were so painful to be hearing these words, and everything just sounded like it was attacking me, and even physically attacking me.
When I was told I was schizophrenic, I didn't want to be schizophrenic. And if you don't want to be schizophrenic, you don't take the pill, so you're not schizophrenic, right? That's good schizophrenic logic.
A lot of people, when they feel symptoms of schizophrenia, they don't want to tell anyone about it, and because when they do, people say, "Oh, you're weirding out or something," and that's not the case, because things that I experienced, like they call them hallucinations, right? Things that aren't there. You see things that aren't there, but those things are there to the individual who's experiencing the hallucinations.
I'd be sitting on a stoop somewhere, and then suddenly I'd realize I was stuck to the cement. Like I couldn't determine where this chair ended and where I began. So I'd be going like this, but this part of my arm wouldn't be moving for me. But you know why? It's because it's the chair. But I didn't really realize that, so I'd be trying to move this part of my arm, and it just wouldn't pick up, and it was just the grossest feeling. It was like, oh God, I'm so stuck.
Well, schizophrenia is definitely now acknowledged to be a biologic illness. And this has really changed in the past couple of decades, particularly, where now I think it's acknowledged overall that it's definitely a physiologic condition.
Unmistakably, it's a brain disease. There is just too much wrong with the brain in too many areas of the brain to not consider this a brain disease. On intelligence testing, our young people with schizophrenia have lost 15% of their IQ points.
It can be very confusing early on in a psychotic illness, making a diagnosis, and there can be many other changes in a person's life when they're young that can account for changes in their functioning or their behavior. Things like street drugs, just changes in the person's life that's upsetting them, coming to terms with who they are. All of these things can cause a person to have troubles that could mimic early psychosis.
Many parents may entertain briefly the thought, is it due to drugs? Because so many young people are on marijuana, and more damaging now, they're moving to cocaine, which can produce brief psychotic experiences. With marijuana, it's more just paranoia. With cocaine, it could be a full-blown but brief psychosis. Ecstasy is worse for paranoid, schizophrenic-looking symptoms, but the magic rule of thumb here is that if it's a drug-induced psychosis, it's gone within 72 hours.
One of the difficulties in early diagnosis of schizophrenia is that it doesn't have a typical presentation. So commonly somebody doesn't present with hallucinations or delusions. They'll have problems in terms of feeling strange or feeling weird, but they won't be able to tell you about it. They'll often withdraw because of those feelings, or they'll start having anger or sadness, moods that you wouldn't have normally seen and you don't understand why. They'll often start doing poorly in school where they may have been a very good student before, or they'll withdraw from sports or other social activities that they would have normally partaken in.
And so, therefore, the onus is on the physician to have the skills to build some rapport, to develop a comfort level, those are the clinical skills you need to collect the clinical information that's so important.
The first important thing is to at least have schizophrenia as one of the things that is there, not as the most probable thing, but just simply one of the things to think about. Because as soon as you've at least got it on your list, then there's a likelihood that you look for the specific things that could point towards it being schizophrenia.
It's really important to trust your friends and your family when they start to notice that you might be acting a little differently, because sometimes we can't see how we're acting ourselves. After 4 times in the hospital, going off my medication and ending up in the hospital, it started to sink in that something's wrong here, that I need these medication, otherwise I kind of go into this weird state and I see things differently, and that's the most difficult thing because there's a lot of stigma attached to having a mental illness.
The longer you stay sick and the more relapses you have, the lower your functioning is. So if you're 17 or 18 years old and you have the wherewithal to find help and get an early diagnosis, the prognosis or the outcome will be that much better.
I was in a life skills management program, and there was a lot of people in it, and so I got to talk with a number of different people on a regular basis, and they all had illnesses, and that helped a lot.
Something in her brain that was so completely different that she couldn't behave in certain ways. I believed, of course, that she wouldn't, but it was in fact that she couldn't, and I didn't know that.
This disease is so tricky. Like my mom and my doctor would say to me, like after I was diagnosed, Emily, you're hearing voices. And for 6 months, I said, no, I don't know what you guys are talking about. And then after 6 months, I came running into the group room, and I said, oh, Dr. Shildrop, by the way, I do hear voices. I just didn't know what you meant. I said, every time a car goes by, I hear them talking about me. But I thought it was real, so why was I supposed to think I was hearing voices? That was just normal. What do you think of that one?
I love that picture.
That picture was taken recently to the other
with
picture that...
relatively early diagnosis and low-dose medication and support from a variety of sources, not just the family, all kinds of things open up for these young people.
Our response tended to be to put the person off, to delay treatment, and to hope that things would right themselves and go away. And we now know that this is exactly the wrong thing to do, that you can actually make a really big difference to the person's prognosis if you begin treatment as early as possible.
There certainly is some suggestion that if treatment is delayed, there may be more permanent and non-reversible changes in the brain.
The theory is that psychosis itself may be toxic to the brain. It's not been truly shown that that's the case, but certainly we have shown that over a 2-year period, if you find somebody early on in their episode of psychosis, you'll have a much better outcome over that 2 years than you will if you find somebody later on in their psychosis.
You have a trial of therapy, too, that it's not as if our drugs are harmful. You can start an antipsychotic medication, a 1-pill-a-day therapy. And if the young person has an absolutely dramatic response to it, you know that, wait a minute, this is a psychotic disorder.
People that have had early intervention do way better in terms of being able to preserve their life and keep things together. Also, they do way better in terms of responding well to the medicine, being able to be on a lower dose of medicine, having a much lower risk of relapse in the future, and being able to restore their day-to-day functioning and win their life back.
I realize now that I have a mental illness, that I have schizophrenia, and I know that I'm equipped with the tools to deal with that.
The miraculous cures only occur in the people on the medication. All the tender, loving care and positive thinking will not cure this brain disease. It requires medication. And the family doctor is absolutely essential to inspire the family to not give up, but to continue on the medication.
When I got better, and after I had been married for 6 years, I returned to BCIT and took a really, really difficult technology there and got honors. And that was at 44. Just think what I have done if I had done that when I was 24.
The thing about early intervention is we hope that if you catch it very early on in the course of the illness, you may be able to either eradicate it or diminish it so significantly that it doesn't affect a person's life.
If you're on a decent drug and it works for you, you can lead a normal life. The place we're at here is a laundromat that my wife and I own. My wife operates. I have a job that I work at 4 days a week that's challenging and that I find enjoyable. And I also have a 6-month-old baby daughter.
I don't have my delusional thinking anymore because the medication takes care of that. But I still deal with the other stuff. And it's hard, but you know, we're all dealt cards in life, and this is one of the cards I've been dealt. And I figure I've just got to make the best of it. So that's what I'm doing.
If schizophrenia is going to be a disorder that goes on for years and years, then effective treatment has got to be collaboration. There's got to be a collaboration between the patient and the family and the professionals, the doctor and the other professionals involved.
I think that's his hope for the future is to keep working at this. So there's a lot of hope for Eric out there, and I'm tremendously proud of him.
My life is better than it's been since I was 17. You know, it's better. Like, I have little problems with my mental illness, but they're like daily stuff. They're not like stuff that are going to bog me down for a year or anything. They're just like daily issues that I go through. I have high hopes for myself. I think it'll work.
It's beyond belief how proud I am of her. Our family has its life back.
It's very definitely an illness that I feel hopeful about. Even having worked with it for the past 10 years, I continue to be very hopeful. When I see somebody, particularly early on, that has this condition, I really feel like I have some meaningful things to offer them in terms of both medicine and non-medicine treatment to help them to maintain the good things in their life and help them to build on that.
I have a lot of hope. I'm pretty positive about my life and stuff, so to anybody who has a mental illness, I say, yeah, life's still possible.